Any special testing that you find that's good for diagnosing dry eyes?
Well, we're fortunate now, as opposed to 10, 15 years ago, to have more good options for helping to diagnose dry eye disease. Some of the more recent tear testing, both the tear lab and Inflamadry, can tell us a lot about the quality of the tears. Also, we have the ability now to examine the oil glands, which is a important component of the tear film, with the potentially LipiFlow for testing. So a lot of opportunities out there for people to hopefully get some good relief.
Dry eye is a very frustrating eye disease to manage, and I just tell patients it's kind of like a marathon in some ways. You're taking it bit by bit, and you're just taking the wins when you can get the wins, and as long as you're managing it, you're going to be doing great,
That's right, and dry eye disease as a chronic disease, have to realize we're not going to solve it in a day, and you're in a partnership with the patient trying to find the best solution, and things work according to plan. It's great, and if not, we'll keep after it and looking for more solutions, which we offer more and more at eye surgeons all the time, and that's great for our patients.
What is one thing you've noticed with dry eye patients over time? What happens when you don't treat their dry eye? What do you think?
Yeah, and that's a good question. People ask, well, what happens if I don't do anything? And there's not one typical story, but classically over time, if you have reduced tear production, that's not going to get better on its own, and it sometimes can lead to damages that we can't undo.
Yeah, I know you work a lot with corneas, and you're a very successful doctor on that. I send a lot of my patients to you, and you do a great job with that. What I've found with dry eye patients is that when you don't treat dry eye, you get this inflammation that's chronic, and it develops a scar tissue around the cornea. So I try to tell patients up front, like, hey, we want to address this issue before it becomes a blurry problem later.